Hello, my name is Kaylee Lane, and I am working with the CDC to help develop a strategy to address the most pressing health-related issues across the United States. One of these issues is obesity. In order to start making progress in decreasing this major health epidemic, we are going to address a specific population, specifically African American males ages 45 to 54 of middle SES status in Knoxville, Tennessee. So, why are we doing this? Obesity is a major health epidemic in the United States, and it leads to a drastic decline in health and ultimately can lead, and most likely will lead, to a premature death. So why this specific group or population is because this group is ultimately chosen because each individual characteristic of this group ranks the highest in their own category. Past interventions to address this epidemic are healthy hospital initiatives, media campaigns, community design changes, and other health-related programs like Steps to Wellness and Worksite Walkability. So, if the community does not properly address this epidemic now, then the leading cause of preventable death will continue to increase, and the overall health will rapidly decline until the community actively fixes this epidemic, because obesity is a disease that prevents a full, active, healthy life. So, in order to address this epidemic, I created 3 interventions that specifically target the population that I have chosen. Intervention number 1 is culturally appropriate dietary intervention. So, diets that are aimed at a specific culture, that are sensitive to specific culture, have been proven to be more effective. And this is because giving some of a specific culture some generic health-based meal like a chicken breast and some broccoli might be a complete shock and something they're not used to. But if you make minor tweaks at their previous diet to a more healthy route, then they are more likely to stick to this diet and make progress. A study found that if the individual is taught how to consume food similar to what they are used to but in a healthy way, then they are more likely to continue with this program. So this can be effectively addressed by teaching these new practices to healthcare workers already aimed at decreasing the obesity epidemic. This intervention will need nutritionists knowledgeable about specific culture-related foods and health facilities to be willing to learn new tactics. A barrier would be that this intervention could be costly for the individual, and usually individuals who have obesity do have lower incomes. So in order to address our barrier, I thought of intervention number 2. Intervention number 2 is education on the fact that the number 1 cause of death in African American males is prostate cancer. So this intervention is kind of a if-then tactic. This tactic could be used as an incentive, as a trickle-down effect. If the population knows the number 1 cause of death for African American men is prostate cancer, and prostate cancer is usually caused by obesity, then maybe health choices will ultimately change. This can be fulfilled by educating at facilities where prostate screenings are done, also by stressing the importance of men's health programs through media, billboards, and social media. A barrier would be if individuals have an egocentrism mentality that this won't happen to me. However, this intervention is very cost-friendly for the individual. My third and final intervention is to promote benefits of cooking at home over the alternative. Cooking at home brings many positive benefits that the alternative, like going out to a restaurant, fast food eating, or getting something quick from the pre-made aisle of the grocery store, does not have. Cooking at home is more cost efficient over time, healthier, better fulfillment, and sense of well-being. This can be implemented from health food chefs promoting the benefits cooking at home reaps through ads, billboards, and classes. If this population realizes how cooking at home benefits multiple aspects of life, they will be more likely to do it. So a barrier to this intervention is that the ease of fast food, restaurants, and other forms have over cooking at home. However, this intervention can convince the benefits of cooking at home outweighs the ease of alternative forms, then this intervention will be successful. So for all of my interventions, there are some specialists needed to address or to actively complete these interventions. Some key points is that this is an epidemic that must be addressed to eliminate the number of cause of preventable death. And the group I chose is the highest affected group. And being culturally sensitive, informative of men's health, and promoting cooking at home will keep pushing the community down the right path towards a healthy lifestyle. And these are some more reasons of why we should care. And these are my references. So thank you guys for listening, and hopefully we can start